Good afternoon, everybody. My name is Graham McLaughlin. I'm a Business Information Officer with the City of St. Catharines Enterprise Center, and in partnership with the Niagara Falls Enterprise Center and the Niagara region, we're here to bring you part 2 of Resiliency Rock Stars today. And I'd like to introduce Neil Cosby, who will introduce the rest of the team. Neil?
Thank you, Graham. It's a pleasure to be back here once again. If you are coming back from last week, welcome back. We're happy to have you back again. And if you are just joining us for today, welcome. This will be a very informative session. We do plan on doing a summary of last week, of which Julie Holden and Hilda Gann, two of our STAR team members, presented on the larger part of mental health at work, what we see happening in the workplace, how COVID has exacerbated that. From there, I will talk about compliance and legislation pieces around mental health at work. And from there, our benefits guru, Aviva Abraham, will talk about some ways you can support your employees with benefits and some other services that are out there. And these can be done. I know most of you are very small businesses. There are packages available that you can utilize to provide these services for your employees so that they are feeling supported during these very difficult times. So on that note, I'm going to turn it over to Aviva and Julie, and they will do a summary. We do have a question already around, will you be able to get a copy of the slides in the recording? And the answer to that is yes. So, and I will also be controlling the slides. So, just to do a little bit of a recap, I've introduced our team and our expertise. Why we developed this program is we definitely saw a need as we are now entering into almost 9 months of dealing with the pandemic. There's a lot of things going on. People are fatigued. They're tired of this. They have been in lockdown or quasi-lockdown way too long. And now, again, we seem to be in lockdown in some parts of the province. Version 2, who knows if that will expand. There's not a lot of hard things that we know about how the journey on this pandemic is going to, where it's all going. One consistent thing that we do know is that there is uncertainty. So, and this is important in terms of your employees' mental health at work on many different levels. As you know, with our expertise, I've highlighted how there is the compliance piece, there is the how you can be supportive piece, and then what is out there in terms of resources that you can support your employees as well. And that's why we have such a multifaceted approach and why we call it the 4 pillars. So I will leave it to Julie and Hilda to kick us off, and take it away, ladies.
Thanks. It's Hilda Gann here, and we just wanted to really give you a summary for those of you who were here. It's a summary, and for those of you who were unable to attend the first one, just giving you a high level of what we kind of talked about. So we talked about the fact that we all have stress in our lives, and during COVID times, this has created what I'll call chronic stress. It's not just like lasting for 2 weeks. Now we're getting into 8, 9, 10 months of stress. And when you have it for such a sustained time, it really is stressful. So this is a gauge of saying we should ideally focus to be in that optimum to moderate stress level instead of excess. Next slide, Neil. And when we talked about excess, this is where we really need to support our staff. And the next slide talks about burnout and the signs and symptoms. We're not spending a lot of time on it, but as a manager, as a business owner, you need to think about, how are my staff doing? Getting to know them enough so that you can look for signs. And just a high level then, maybe their attitude has turned negative, a change in behavior. Maybe they're absent more, they're late, there's some physiological changes that you might hear them say that they have frequent headaches. So this slide is here for you to look at later, and we just wanted to spend a little bit of time on that. Next slide, Neil. So this is about fostering a mental healthy workplace, Julie.
Thanks, Hilda. And so I'm Julie Holden, and welcome everyone. We are happy that you're here. Um, so when we talk about a mentally healthy workplace, how does that compare to an unhealthy workplace? So just a quick recap, some of the things that we would see in a healthy workplace is, transparent communication and giving everyone the tools to do their jobs and things like that, job clarity. And if we think of an unhealthy workplace, I'm sure you can think of some words on your own. We see anger, fear, confusion, anxiety, those kinds of things coming out of the workplace, not outside. So those are some things you can look at a little later on. So we'll move on and think about how employees can help maintain their mental health. And maybe later you can take a closer look at this slide. I'll just go through a couple. Um, we talk about balancing work and life. That's so important these days with people, working from home a lot, and they've got their kids at home, perhaps they're homeschooling and everything. So it's so important to prioritize different tasks that you're trying to do and try to balance that out and make sure, there's some thought that goes into that so it doesn't sort of take over your life. Another one is to seek care. As Hilda was mentioning, our stress levels have gone up, unfortunately, and this was an issue pre-COVID, and it's certainly an issue now. So, seeking care, just talk to somebody. It's not a big deal. There should definitely be no stigma attached. Just reach out and talk to somebody. And now we'll talk about what employers can do in their workplace. Neil, if you would. Thank you. So, fostering a positive workplace culture is so important. And one of the main things a leader can do is be open and talk about mental health. And that doesn't mean that they need to, disclose things that they don't want to disclose, but just making it a safe place for people to talk about mental health is so important. There's a lot of great things here. Aviva is going to talk about benefits, which are key to this as well. And really make employees feel supported and valued is so important. And with that, we'll move on to the next one. Neil, thank you.
So the summary of what we did last week was really then talked about the role of the manager and the role of the company and what you can do to help. Next slide, Neil. And what I shared with you was a concept that I created when my husband and I had a best workplaces company. We're really focused on creating a strong work culture. And it's called the Rev Up approach. And Rev Up actually stands for five qualities and principles. It's an acronym. Rev Up then stands for treat people with respect. Look at them with equality and then value them as in I value you. Look at the uniqueness of the individuals in your organization and tap into their potential. Tap into those things that they're really strong at. And this will help you manage more effectively, create a stronger work culture, and help build your business in a very more positive way. It's such a stressful time now with COVID. And the last thing I wanted to talk about, which we shared last week, was some strategies for difficult conversations. There are so many points in your business that are stressful. So if we can show them the next slide, Neil. And I gave you some tips and strategies on those difficult conversations. They may be work related in terms of maybe you have to downsize, maybe you have to talk about a performance issue, or they may be more personal that affects the workplaces where somebody's having difficulty coping with some personal issues at home that really affect the workplace. So the 5 tips I shared was, first of all, start with a place of neutrality. State what you observe. Don't create an opinion that they're not performing or that you've figured out what it is. Just state neutral facts. Then listen, and then through listening, figure out together what the solution will be. And don't be afraid to answer that you need time to get back to them and make sure you follow up. So this will help you strengthen those relationships and will help you with some tips and strategies on difficult conversations. And we gave you some resources from the last slides, and we were saying now it's ready for part 2. And here we are, part 2.
Great. Thank you, Hilda and Julie. Just a few housekeeping items before we move on. If you want to use the Q&A or the chat to ask questions, by all means, go ahead. If I can ask one of my colleagues to keep an eye on those questions, and please feel free to interrupt me if we have one and we can provide an answer. As I said, I'm Neil Cosby, and I'm part of the Rock Stars Resiliency Program. I've been an HR consultant for a number of years now, and through that I developed a network with Hilda and Aviva and Julie, and we have come together to present this. And my piece in this is about compliance and legislation. I just want to start off by saying I don't do this from a fear-mongering perspective or a thou must or thou shalt comply or get in trouble. This is purely information and educational for your benefit, and to advise you of some things that you need to be aware of when you have your own business. Some of these things that we talk about are dependent on your employee size and may not be applicable at the moment, but as you grow, they will be. And I think it's best that you're aware of what's coming down the pipe as you grow your business. So the pieces that we're going to discuss today, and there is overlap with all of them, is the AODA ISR, which stands for Accessibility for Ontarians with Disabilities Act, and the Integrated Accessibility Standards Regulations. We will also discuss the Ontario Human Rights Act, the Workplace Safety Insurance Act, and the Occupational Health and Safety Act, all of which touch on the pieces related to mental health. So let's start with AODA or ISAR. This came about in 2005, just to give you a brief history. The goal is to provide accessibility standards that remove barriers for people in the areas of employment, communication, transportation, and customer service. If you have one employee, then you have obligations under this act. And as you grow, one threshold that is there is if you have 20 employees, there's another threshold. And then if you have 50, there's another threshold. For some, it may seem like a cumbersome piece of legislation, and it is somewhat challenging to go through it and decide what's relevant for your organization and what isn't. And the full implementation for AODA and IASR is 2025. And that date has been a moving target that has changed a couple of times. Important to note here, AODA is the act and IASR is the standards. And just before I talk about this slide, at a minimum, as I said, if you have one employee, your obligation is to provide customer service standards training. And that is to train your employees in how to work with customers that have disabilities or illnesses, including mental health. Okay, so the 4 core principles of AODA: dignity, independence, integrative manner, and equal opportunity. So these, it is meant to be delivered in the areas that I discussed that promote dignity, give the person who may be disabled independence, is part of a larger philosophy and a larger way that you deliver services to customers, communicate with them, or how you relate to them in an employment manner. and of course, equal opportunity. It is about breaking down barriers, making the playing field fair in terms of the opportunities that are available to people with disabilities, because for far too long, there was a lot of discrimination, which was allowed, to be quite honest. And we are now taking steps to remove those barriers, because we know that people with disabilities have just as much to offer as anyone else, the so-called able-bodied. And when I talk about mental health in this realm, as Julie and Hilda indicated last week, the stigma of mental health, I would say, is a lot larger than those with other types of disabilities, for a number of reasons. Because it's largely unseen. It's not, we don't know, we're still finding out ways of which the brain operates. So it can be quite challenging for some people that are employers to be able to understand, what can I do for my employees that are experiencing mental health challenges. So within the IASR, there are 5 standards: employment, information and communication, transportation, design of public spaces, and customer service. For our purposes today, we will be focusing in on the employment component of this, and that's where our focus will be. So in the employment standards, you are required to make your workplaces and practices accessible to current or prospective employees. And these are the 6 areas which I will talk about within this slide. Within recruitment and hiring, you are to, if a prospective candidate indicates that they require accommodation due to a disability, it is on the company to supply that accommodation. And in fact, organizations should be asking up front when they are setting up like interviews or things like that, do you require accommodation? And it also should be indicated, if you post for jobs, it's a good practice to post that on your postings as well. Information and communication supports. And this relates to when you have to communicate information, is it in an accessible way for people that maybe have challenges with abilities, that they are able to receive it, understand it, read it. And so again, it is taking those steps to ensure that there is the way you deliver employee relations is done in an integrative manner. And an example of that would be if you have somebody with eyesight challenges, you may need to adjust the way that the font on the website is, how it appears. It may have to be a little bit bigger and things like that. Individualized accommodation plans. So when an individual with a disability, and I just need to go back here, in the way we talk about people that are experiencing challenges in the workplace these days, we're trying to get away from using the word disabilities and use the word abilities. So you may hear me interchange between the two of them. But when I say disability, that is not meant to be disrespectful or judgmental or anything like that of people that are experiencing some physical or mental challenges in the workplace. So individualized accommodation plans, when an individual has a challenge and they require some sort of modification to work in terms of maybe how it's done, the hours they keep, where it is done, maybe they need some type of equipment to help them complete their tasks better. The onus is on the employer to get that accommodation plan in place so that the employee is able to contribute to the workplace just like any other employee. Performance management and accommodation plans. And sorry, I should just going back to individualized accommodation plans. These accommodation plans are unique to everybody. There is not a cookie cutter approach for the most part. They cannot be generic. In performance management and accommodation plans, recognizing that an individual has a challenge in the workplace with respect to their abilities, it is sometimes necessary to adjust how they will be assessed on their workplace performance. It is not about lowering standards. It is not about cutting them a break, so to speak. It is about adjusting reasonably so that they can be put in a place of where they can put their best foot forward to achieve their key performance indicators. And again, with accommodation plans, setting out those accommodation plans, which are part and parcel of their performance management. Individualized emergency response plans. So if you have an individual that has challenges with abilities and you have an emergency at work, say a fire, they may not be able to evacuate like everybody else. So in that sense, you have to develop a plan to be able to evacuate them. It may involve getting other employees involved to assist that person so that they can evacuate along with everybody else. If you have a person with a hearing impairment, how are you going to notify that person that there is an alarm going off if they can't hear it? So it's things like this to keep in mind as you're moving forward. And return to work process. If an individual has to go off because of a physical or a mental issue that has arisen, coming back to work, there needs to be a plan. And it could be such things as a transitional return to work process. So maybe they're doing less hours to start off with and working up to doing full-time hours. They could be having some assistance as well. There are a number of ways that you can have a person return to work after an illness or an injury or a new something that might be a long-term impairment that can assist them to come back to work very successfully. And I'm going to talk a little bit more about mental health issues in the workplace with this. The return to work process for people with mental health issues and a number of these, all of these components that we've talked about, these are all applicable to people who may have some mental health, who are living with mental health issues. They are totally entitled to all of these components, and you need to take and a lot of this will be dependent on what kind of medical information is there, what are is the person's healthcare team recommending for them in the workplace so that they can return successfully or be a part of an organization in a successful employee capacity. So, and again, a number of these things in the AODA and IASR, some of these already existed. And the AODA IASR explicitly states that they acknowledge that this is part of some other pieces that are out there, which we will talk about. And where necessary, they will defer to the other pieces of legislation, okay? So the Ontario Human Rights Code, under the employment code of the component, the employment component of the code, people with disabilities are entitled to the same opportunities and benefits. It prohibits discrimination on any disability or illness, and this includes mental health issues, okay? And it applies to transfers, promotions, recruitment and selection, dismissal, and many more areas. So the Ontario Human Rights Code is administered by the Ontario Human Rights Commission. And just a few other details on this. It's not just employment that the Ontario Human Rights Code covers. They also cover such things as support services, accommodations, and other things. But it is in the employment realm where the Ontario Human Rights Commission receives the bulk of their complaints. Almost 80% of human rights complaints are in the employment realm. And the biggest subset of the employment realm where they receive their complaints is in the recruitment and selection component. So individuals may feel that they were not selected for a job, selected for an interview because they had a disability of some sort that was either obvious or came out during the interview process, and they felt that that was the reason they were not selected to move on. So it is important that you as an employer, when you are selecting people, that you ensure that your questions, your postings, your job descriptions are free of anything that might look like discrimination. And I want to talk a little bit here about two types of discrimination: overt and adverse. Overt is pretty open. If you put in anywhere in part of your recruitment and selection tools, must be a male, must be a certain age, that's overt discrimination. Adverse discrimination is the adoption of a seemingly neutral policy, process, or component that negatively impacts a certain segment of the population. So you may have the best intentions and not be wanting to violate any laws or knowingly discriminate, but you may put something in your job requirements that quite frankly, inadvertently rules out a segment of the population. Okay, and it can be something as simple as must be available for work on 3 shifts. Well, there are some people with religious accommodations that are not able to commit to that. And the questions you can ask to ascertain if people can do that are very limited in their parameters. And when it comes to people with, that maybe have some sort of ongoing or intermittent disability, you cannot ask the question if they have a history of that at all. So it is important to know what you can and cannot ask. And quite frankly, the only reasons that you can deny a person an opportunity for a job, a promotion, or transfer is based on knowledge, skills, abilities, and other relevant attributes. That is all that matters. So under the Ontario Human Rights Code, accommodation, which I've kind of referred to in a couple of previous slides, that is important when you have employees with disabilities. It is very rare that you will find a company that cannot accommodate to some degree, although the ability to accommodate can be different. For instance, a mom and pop Avondale store, their ability to accommodate is a lot different than an IBM because of financial resources. You have a due diligence in finding ways to meet the needs of employees who need some alterations to do their job. So whether it be reduced work hours, frequent breaks, there's just a variety of methods to assist employees who have long-term disabilities or illness or short-term. What we find when we have people that are living with mental health issues is that sometimes it's intermittent. You may have a person who does well for a very long period of time, and then something is triggered, like COVID, and they're not well again. So again, they may have to be off for a while or may require some accommodation. So the individual, there are rights and responsibilities on the side of both parties, employers and employees. The employee has to indicate that they require accommodation, and they do have to provide necessary documentation. But it is in the employer's best interest to work with the person, to try and support them while they are off with their challenge, and to get them back to work as quickly as possible. So when does accommodation not have to be met by employers? There's two components here: undue hardship and bona fide occupational requirement. So under the undue hardship realm, if a person's accommodation is going to pose financial hardship on a company, or it is going to impact the health and safety of other employees in the workplace, or they are not able to find outside sources of funding to provide the accommodation, the company may have, or the organization, I should say, may have a right to say, we're not able to do this. And that goes back to my earlier example of the difference between an Avondale corner store mom and pop operation versus an IBM. Financially, to provide an accommodation may be very different. And bona fide occupational requirement: when you are developing your job description and you are indicating what the duties and responsibilities are, you have to ensure that it is absolutely something that needs to be in there so that it doesn't, as I said, does not impact a certain segment of the population. So if you have a bona fide occupational requirement, and it does impact a certain segment of society, but you are able to prove that it needs to be in there, then of course you have a case for saying we're not able to, what's the word I'm looking for? We're not able to look at people with that may have disability challenges because this is a necessary occupational requirement. Okay. These are very rare, but not impossible. And you as an employer is, you have to be able to prove this. So I see a couple of questions that I'm just gonna take a look at here. Okay, oh, sorry, just a couple of comments. So I'm just gonna flip through here. Oh, lost control of the slides. Oh, here we go. So my final piece is second to last piece is Occupational Health and Safety Act. The employer is responsible for ensuring a psychologically sound workplace. It has to be free of harassment, compliant with the Occupational Health and Safety Act. It cannot be a toxic workplace. And what we find with places where they are toxic or have harassment, which Julie and Hilda talked about, they can cause extreme stress on people, and people can get depressed and anxious. So you are responsible for making sure not just that there's physical safety, but psychological safety as well. Under the Workplace Safety Insurance Act, which is part of the Workplace Safety Insurance Board, the employer, when somebody gets hurt at work or gets ill as a result of a workplace component, this is the compensatory piece that workers will get paid for. The employer pays for WSIB coverage, and the employee doesn't pay a dime. So if you are hurt at work, if an employee is hurt at work or they get ill, this is what they apply to. And there is a process to go through in terms of filing an incident report, getting benefits for the employee. And this is now, they're now looking at the impact of psychological trauma in the workplace. So there have been some cases where people that experience long-term harassment in the workplace, they applied to WSIB. their application was approved, and they are now receiving benefits for that occurring in the workplace. COVID-19 work-related trauma is under consideration. As we have spoken about, a number of people that are coming back to work, they are concerned, they are anxious, they are worried. So the employer has to do everything within its power to ensure that they're taking care of following all COVID-19 protocols and ensuring that there is psychological safety. I think for the most part, and I'm just going to end off with this before I turn it over to Aviva, and I've gone way over my time. I think for the most part, organizations are following protocols. Anecdotally, I've heard of a couple of things where organizations have said to employees, this isn't real, or we don't need to wear masks. This is all not true. And of course, that can create a huge trauma for people who are taking this seriously. And although there are avenues for them to get that addressed, when you need a job and this is your only job and it's not a great economy out there, some employees may feel they have no choice but to put up with this. So on that note, I'm going to turn it over to Aviva, and I apologize for taking so long with my piece. Aviva, over to you.
Hi, everybody. So what I'm going to cover today is the group benefits part of this. Today, I want to share with you, and Neil, can you switch those slides?
Yes.
Next slide. Okay. What I'm going to share with you today are the changes that have happened in group benefits due to COVID. Some of the new resources that insurers have made available because of what's happened with COVID, and what to expect in 2021. So my specialty is working with small businesses, teams anywhere from 1 to 50 employees, and self-employed professionals. So understanding the challenges of small teams, which is actually very different than big corporate. I know that not all of you here today have group benefits, but it's still good to know what's out there and what resources there are on the healthcare side, and how that can help you, how that can help your business, and how it can help your team. Next slide. So there are 3 ways that benefit plans help support employee health. The first is with the physical and the mental health care coverage. So up until recently, traditionally, group benefit plans supported teams more on the physical healthcare side. And still in today's world, that's very, very important. Whether it's COVID or anything else, supporting them on the physical healthcare side makes them more productive, helps them to show up, reduces absenteeism. The highest claims on a group plan would be for drug and on the therapist side. So massage, physio, naturopath, things like that. The last few years, though, there's been a lot of attention paid to the mental health care side, and that's become more important. And COVID has brought this to the forefront even more. So the insurers actually, they've rolled out additional resources in a faster way now because of everything that's happened with COVID to help Canadians deal with the stress and anxiety and other mental health issues that have arisen due to isolation and illness and financial stress. And I'm going to talk more about those resources shortly, but just that's the other main way that group benefits help. One of the added coverage enhancements that they've had recently is they've added cognitive behavioral therapy to the plan, because they see that early intervention with this kind of therapy is now been proven to speed recovery. And previously that was only available if you paid an additional fee with an EAP. Now it's part of the extended healthcare benefits. So there are ways that they are enhancing coverage because of COVID. Next slide. Okay. The second way that employee benefits help your team is with the digital healthcare options. So there are online resources that your team can access, articles, lists of therapists, lists of specialists, and a library of information on various healthcare and financial topics that your team can choose from. There are assessment tools that they can use, which help you track and improve your health. And there are incentives for implementing a healthier lifestyle. They also have rolled out virtual medical care. Most companies will do this at an additional cost, but it's very, very well worth the cost in order to be able to access doctors and nurses, nurse practitioners for your team members and their family. They found that using virtual medical care, 70% of the time, that helped members not having to go out to a doctor, to a clinic, to a hospital, and could be diagnosed from the comfort of their home or from their office. Not only is that a time saver, whether you work at home or in the office, but it's a safer way to handle things now that COVID is part of our lives. Next. So here are some examples of the virtual healthcare solutions that different insurance companies have come out with. So Canada Life launched their Dialogue. They're actually the first and only insurer, I believe, at this point that has it as part of their standard benefits package. So they're not charging anything extra for it. They're including it as part of their benefits plan. It's similar to the Sun Life virtual care, which I'm going to discuss in more detail next. And that is, their program is called Lumino. So when it comes to Sun Life's plan, they do charge an additional fee, but as mentioned before, it's really, really worthwhile, and it saves your team time and is the healthier way to handle it. It's immediate virtual access to healthcare professionals via video chat with whether it's a nurse or a doctor who can diagnose a condition that doesn't require a physical exam. So they can determine if they can diagnose you or if you may actually need to go to a clinic or a hospital. It also helps plan members book specialist appointments, including mental health practitioners that they may need to speak with. So it helps with the continuity of care because they can follow up on test results with you, book follow-up appointments. It also helps you with the navigation of healthcare because they assist you in helping find these specialists and book appointments. And they also assist you with pharmacy delivery services where you can have your prescriptions sent to your home or to your work. Next. Manulife has a program called Health by Design, and theirs is a little different because they're saying that their program is more customized to each team member and more on the proactive side of things. So what they're saying is they're trying to prevent a situation from getting too critical. So if somebody's dealing with stress and anxiety, if someone's dealing with stress and anxiety, they will step in before and try to prevent it from getting to a place where they would need to, let's say, go on short-term or long-term disability. They also will intervene to prevent absences and help the person deal with the stress and anxiety or whatever mental health issue they're dealing with. And then they help you with the recovery by continuing to provide the support. I actually had a video and it didn't seem to come through. Neil, do you see it on your end?
I do not, no.
No, somehow that didn't come through. Oh, well, we'll see if we can get that sent when we send the slides over. But it just showed how the Health by Design program helped one of the employees with dealing with stress and anxiety. They helped him with his medication, managing his medication. They helped him maintain himself in a place where he didn't have to take any time off from work, and he was able to get the care that he needed so that he didn't deteriorate on the mental health care side. Next. The third way that group plans support employees is with employee assistance programs. Again, most companies will charge more for that, an additional fee in order to have that, but they will allow you for that fee to access additional services. So it's a per employee fee. Usually it's, between $3 and $7 an employee. And different depending on the level of program that you sign up for, but it does help you with family and social relationships, depression, anxiety and stress, work-related issues, crisis and traumatic events, and even limited legal and financial advice. If your team has some long-term disability coverage, some companies will include the employee assistance programs with the disability coverage, but otherwise you do have to pay extra. And I did have a few clients that signed up for the employee assistance programs during COVID just to support their team, because it is very useful. Next. So my suggestion, if you do have a group benefits plan, is to call your insurer or your advisor to find out exactly what resources you have, because as you see with each company, they do offer different kind of resources. And even when you sign up, you may be signing up for one particular plan as opposed to another. So you either would be best off to call your provider or your advisor to find out exactly what your plan covers, what is able to be covered, so that you can support your team in the best way. Even sometimes if you have to pay an additional fee, it might be worthwhile if that means that you can support your team member and they don't need to go on disability, or if they're managing better in the workplace and for what they need to do on a day-to-day basis. Next. So what can we expect in 2021? Well, unfortunately, they are forecasting an increase in disability claims. They're also forecasting an increase in costs of healthcare and the need for additional mental health support. The good news is, though, that there are a lot of resources available today, whether it's from the government, from different organizations, from consultants and professionals like you've seen here today presenting. There are a lot of resources that are available to help support your team. Hilda and Julie actually provided a whole list of resources last week as well, and I'm going to add 2 more resources on the next slide. Sorry, just the next slide.
No, it's my computer.
Sorry. Neil's managing all the slides today.
Yeah.
So there's a company called Inkblot. They're actually a bit of a disruptor in the EAP field, so the employee assistance programs. They've come out with a new model where they're looking to support team members on a long-term solution. So whereas other EAPs will give you a certain amount of therapy sessions or a certain dollar amount to use, and then you have to go to a different provider and start over with another therapist. With Inkblot, you can continue the same therapy with the same therapist at reduced costs. So they offer in their network much lower costs of therapists than other EAP providers. They also have what's called a member intake and artificial intelligence that they use in order to match people up with a therapist. So they do a very, very good job of matching people, and they make sure that you are a right fit. And if the first person is, they'll look for somebody else. But they've taken this long-term view so that they can follow through from beginning to end and help people get the support that they need, and at a very reasonable cost. So whereas an employer can sign up their team for, I believe it's about $500 for the year for teams up to 40 people. And then they decide if they want to pay for additional therapy, or they let their employees pay for the therapy that they need. Some of that therapy will be covered by the group plan. If they use up everything in their group plan, then they'd have to pay out of pocket. But there are a lot of resources that they offer. And we've gotten very, very good feedback on companies that have used Inkblot. So they're a great resource. Another resource that we've had our clients use is something called Pocket Pills, which is a free and discreet prescription drug delivery. So if you don't have a group plan, or if your pharmacy doesn't deliver your prescription medication for free, here's a resource where not only can you get your drugs delivered for free, but you can speak with the doctor to either renew or request your medication. So I hope that that was helpful. There's one more slide, I believe, that I have. Yeah. So if you have a group plan and you're looking for additional resources or support for your team, or if you don't have a group plan and you want to know what's involved and how you can support your team on the healthcare side, Or if you're a business with no employees and you're just looking for some healthcare coverage, feel free to reach out to me and book a complimentary call. I'll be happy to answer your questions. If you have any questions about my presentation, I'm not sure if we have, how much time do we have?
Oh, we've got 8 minutes for questions, and
Yeah, and
I see one in there. Oh, it's a compliment, a very nice compliment. Someone who is a life coach, and they provide EAP. They said this has been fantastic, and they thank us very much.
Thank you.
So, but yes, we do have time for questions, and just to a couple of extra pieces just to let you folks know. And again, without sounding like a fearmonger or anything like that, but this week, and it may have been late last week, the Ministry of Labor announced that they are undertaking a blitz to visit workplaces to ensure that all health and safety protocols are being followed with respect to COVID. And quite frankly, folks, they're not fooling around. They will fine. The fines are pretty hefty. If it's that serious, there could be a move towards charging businesses, and then that necessitates an appearance in court. I know in Niagara, where I'm currently situated, towards the end of, I think last month, they charged 10 places. 8 of them were fines. And the other 2, they laid charges, which the employer now has to go to court to answer to. And again, this is all, I know there's a lot of debate out there around, why do we have to wear masks? There's even some deniers out there. And I know that that's going to be, you're going to have that divisiveness in the workplace. As an employer, you have the obligation to defer to anything that is in legislation that is being is being directed by public health or by the other relevant pieces of legislation like the Occupational Health and Safety Act, and even to some point the Employment Standards Act.